Hi there, I'm Dr. Stephen Phelan. Welcome to this video. Today, I'm going to answer another question from my webinar Questions Answered video series. And I'm going to answer a question from my vertical dimension case studies webinar. And this is a good question. It's from Dr. Tim Barker. And he's asking, I have had one or two patients with severe wear on the posteriors so that there's little occlusal height, but only mild to moderate wear on the anteriors. Do you have to take a different approach with these cases? And the webinar vertical dimension case studies, I'm showing different ways to open the vertical dimension to restore missing restorative material. And part of that is opening beyond to or less than the point of initial contact with the models mounted in centric relation. And if you have pretty severe posterior tooth wear, usually there's no large PIC vertical opening space. So the case that you're speaking about, Tim, you'd have to mount the case to really know. But sometimes you could be surprised. You have a lot of posterior tooth wear, you mount the case and you've got a fair amount of room in the PIC with the PIC contact to have room for restorative material in the posterior. The problem with your case, it sounds like, is that you'll have too much space in the anterior. So if you need room in the posterior, because you don't really want to prep the teeth down further, but you have then too much room in the anterior, you'd end up with an anterior open bite if you restore the posterior the way that maybe they need to be. So what you have to do in a case like that is you have to look at two options. One option is you do orthodontics. So you have the orthodontist perhaps extrude the anteriors a tiny bit or intrude the posteriors with the implant anchorage, so the little orthodontic implants. So you could intrude the posteriors, extrude slightly the anteriors, and have the orthodontist finish the ortho case with a posterior open bite. So you'd have the orthodontist intentionally create a posterior open bite, which then gives you the room for restorative material. And that's a great option. It will take some time, and it's not something everybody's going to want to go through. So if the patient won't go with that, then what you have to look at is, will you have enough room for restorative material without creating too much anterior open bite? So you have to find the balance. And this can be tricky in some of these cases. I'm doing one right now where a patient doesn't really want to do orthodontics, but fortunately we can lengthen the anterior teeth a little bit. So the lower anterior teeth, she has a bit of an anterior lowering or lower step to the incisors compared to the posteriors, and the posteriors are pretty worn. So cuspids aren't as worn, and then she has a step for the incisors. So we should be able to, we haven't done the wax up yet, we've only done the treatment planning, but we should be able to thicken the posteriors and also lengthen the lower incisors. And we're going to lengthen the upper incisors. So we should be able to close the potential anterior open bite by lengthening the teeth. But then you have to test that out and make sure this tooth lengthening is looking good in the patient's mouth with the provisionals. So if they're not, you have to shorten them a little bit, which would mean equilibrating the posterior a little to close the open bite. One thing that you can consider is doing more additive restorations to the posterior, so more onlay-like as opposed to crowns, because a lot of these cases, they're pretty, like this case had some pretty flat posterior teeth. I can't really crown them very well anyway, but they could be good for overlays or onlays or occlusal veneers. We could crown them if I crown lengthen them, but I don't really need to crown lengthen them if I use adhesive dentistry, immediate dent and sealing, and do an additive buildup of the occlusal surface with a occlusal veneer. So you could consider occlusal veneers where you don't really need to create as much space. You could get those down to 1 millimeter thickness of monolithic Emax, and I've had good success with that. They do say 1.5 millimeters, but I know Dr. Pascal Magnier is testing out even less than 1 millimeter. He goes as thin as they'll let the milling machine allow milling to be. But I've tested 1 millimeter and I know that that'll work. So you could end up with 1 millimeter of space if it's only one arch that you have to add restorative material. If it's both arches in the posterior, you'd need 2 millimeters of posterior space. if you're not prepping the teeth down any further occlusally, which could lead to a fair amount of anterior space. So that's what you have to look at. You really need to have the models mounted on the articulator, and you have to create the posterior space with some form of, even just putting in some form of thickness indicator, and look at what space you have in the posterior, in the anterior. And these things you'd figure out with a wax up ultimately, but before you do the wax up, while you're treatment planning the case, you'll need something, you could even just put a millimeter thickness of sticky notes in the posterior and look at how much anterior space there is and get an idea of whether or not it's feasible to do the case without orthodontics. Some of these cases will need orthodontics, that's the bottom line. So hopefully that helps. I think orthodontics is one option for your patients like this. The other option is you're going to have to lengthen the anterior teeth. And if the patient can accept that, and if the patient has short anterior teeth where that could work, then it's fine. But if the patient already has long anterior teeth and you have to lengthen them more, could be a problem. So these are the things to look for. Ultimately, it'll all be worked out with the diagnostic wax up, but then you have to test it with the provisional restorations and see how this looks, functions, and feels in the patient's mouth. So hopefully that helps. Once again, if you're interested in this kind of dentistry, you want to see some cases where we altered the vertical dimension, some rehab type of cases, you can go to vdoseminar.com. That's vdoseminar.com. And register to attend my Altering the Vertical Dimension case studies webinar. Thank you very much, and we'll talk to you soon. Take care.